In my opinion, I think that depression is when you're constantly sad or you have no hope.
I think depression is like when somebody is like very sad about like, could be like multiple things that like, you know, starts to like affect their life.
Depression is an overwhelming feeling of sadness or not being needed.
I believe depression is a sad feeling that you get internally, and I feel like it's something people don't ever talk about. Like, friends don't even know they have depression. It's just like a sad feeling overall.
You feel really sad and unmotivated.
I believe depression is when a person feels inner sadness from either hate from others or something that occurred in their life, and they feel so deep down sad.
I think that depression is when your mind is in a constant state of sadness.
Depression is where you are sad all the time and you want to die.
Depression is when someone gets really sad and it starts to affect how they go about life.
Depression is like a mental illness where you feel down and sad and depressed.
I think depression is just anytime somebody is feeling down or not as happy as they have like the potential to be.
Depression is something that you can either live with or gain, and it is something that comes from the inside and out.
Psychologists define depression as a mood disorder, and it generally is identified as feelings of depressed moods, feelings of personal worthlessness, and general disinterest in regular lifestyle activities. And it seems to take place over a long period of time. Everybody gets down now and then and bummed out, but clinically that's not viewed as depression. There is a duration component to being depressed. And the clinical definition includes a timeline. So it's got to be for several weeks or longer where you have these feelings of worthlessness and disinterest in activities in life.
People think that they don't have a say or they don't have like a place in the world, or they feel like they don't belong.
I mean, I think it's things that happen in your life, like super impactful things. I don't know, it can be anything. Or it's people cyberbullying you or saying mean stuff to you. I think it's all around us. We're at Jackson High School, it's everywhere.
Usually I think what causes depression is when someone has no hope in
Things in your life that make you sad.
Maybe you don't have any cats and that's why you're depressed.
Probably life.
I think multiple things like cyberbullying, bullying, I think personal like life issues, and
Just life, I guess.
I think the causes of depression are simple, like even not having money, just
People have problems and they don't speak up, and like they don't get the help that they really need.
Current psychological research sees a combination, what psychologists call the biopsychosocial model. And there's a biological component, a psychological, and then a social component. So starting with the biological component, there is the neuroscientific perspective that depression is a function of abnormal levels of brain chemistry. Certain neurotransmitters are lacking, or certain receptor sites on neural cells aren't receiving appropriate amounts of certain neurochemicals. That's the biological model. The psychological model suggests that life experiences, either in the past or currently, and a person's reaction to life experiences lead them to make value judgments about themselves and their own worth and their own capabilities. So the psychological model suggests that it has something to do with how the person interprets life experiences. The social component then of the biopsychosocial model of depression suggests that how a person interprets the obligations that they feel society places on them and the interactions they have with other people, whether they're positive or negative, can lead a person to develop this sense of worthlessness. Because as they see themselves within the society, they're not accomplishing as much as they think they could, or as much as they think they're supposed to. So it's hard to pinpoint one particular cause of depression, and that's why psychologists refer to the biological, psychological, and social model. It seems to be a combination of all of these.
Try to do positive things like help out in your community or do sports and stuff.
I think support from like family and friends or just anyone around them.
I would say probably more people around you that care about you and need you.
I don't know, counselor, those are always a good option.
Counselor or like a psychiatrist.
Cats.
Counseling is a really good idea for people who have depression.
There are lots of treatments. There are lots of treatments for depression. In the medical model, psychologically, the treatment generally is based on the nature of the diagnoses. Frequently, and especially in the modern world, we tend to follow the biological model, and the belief is that depression is a function of neurochemical imbalance. So treatments under those kinds of perspectives would include certain kinds of drug therapies. Certain antidepressant drugs will help modify and balance out neurochemical and brain chemical interactions. Social and psychological, psychological and social models, those perspectives can involve modified behavior therapy, psychoanalytic therapy, where you get exposure to situations that might cause you to feel nervous, and you go through training kinds of exercises. There are also sort of deliberate lifestyle choices that you can make, not only diet and healthy activity choices, but also your choice of the kinds of social interactions that you participate in. So for depression, there are lots of available treatments, and each of the treatments are a function of the particular perspective that you take as a cause of depression.
Yes, I do.
Because it's taking lives, so it's definitely an issue.
I don't think it's a major issue. Yeah, I think it is a major issue.
Like, I don't think it's talked about enough.
I think it's a major issue. People are losing lives over it every day, and I mean, you can't really do anything about it. People try, but you can't do anything about it, which is kind of sad.
Yes, it is.
Absolutely. You know, and depending on how you identify or define what a major issue is, if you look at it economically, I imagine there have been studies done that can calculate, just at an economic level, the amount of work days that are lost, the loss of productivity of the individual within an economic system. So you can put a number on the kind of issue that is. But I think psychologically, from the perspective of the sort of person as functioning positive participant within a culture, right? The idea that the better we all are, the better each of us is, the better we all are. And so if people are depressed and they're in a society, that has a negative effect, not just on others, but on that individual themselves. And, you know, given what I do for a living, I am I am interested in making sure that people feel like they can move into their own lives with a positive attitude, with a feeling of accomplishment, a sense that they are competent and can participate in their own lives successfully in a way that allows them to take control of their lives. The more people who can do that, the better we all are. And so when people can't, yeah, it's a huge social problem, not just economically, but holistically and from what we would call the affective domain.
Okay, thank you.
Hi Lucy, nice to meet you.
Hi.
So I understand that you were referred here by your GP because you've been feeling quite down recently.
Yeah, I thought I've been feeling quite bad for quite a while, so I thought maybe it's time to see someone about it because I don't want to feel like this anymore.
Okay, so from your notes I saw that you saw the GP about 3 months ago.
Yeah.
So how long have you been feeling down altogether?
Quite a few months before that as well, actually, but it's gotten pretty bad these past few months, so that's kind of why I came.
Okay, so has it got worse since you saw your GP?
Yeah.
Okay, so tell me, how are things at the moment?
Well, it kind of started just feeling a bit low and wound up about things, but I don't know, just recently I just can't really be bothered to do anything at all. I kind of find it hard to get motivated for things, and I really want to be better, but it's just kind of reaching the end now where I want to do something about it.
Okay, so you said that you're feeling really down, really sad.
Yeah.
And you feel like you haven't got any motivation. But are you okay?
Yeah, I'm fine, sorry.
Okay, and you haven't got any motivation, but it sounds like you're putting quite a lot of pressure on yourself to try and feel a bit better.
Yeah, it's kind of hard as well because there's not really anyone to talk about, so I just kind of stay on my own I don't like to think about it, but I just know.
Okay. So
recently, whenever they want to go out or stuff, I don't want to bring them down. They don't understand what I'm going through. They kind of, I don't know, they don't make fun of how I feel, but they don't really understand what it's like. I don't want to go out with them and bring them down or stuff.
Okay, so do you try and hide the way you're feeling from them?
I guess, it's easier to hide it than to try and explain it all the time when no one really wants to know.
Okay, so it sounds like you've been feeling down, you've been feeling unmotivated, you feel like you want to be better, but actually it sounds like you feel like you can't reach out for help, you can't speak to anybody.
No, I don't really talk to my parents a lot either,
okay.
So that's kind of hard.
Okay, I'm just going to go back in time a little bit. I suppose I'm just wondering when...
Yeah, I do.
I don't know anyone personally, but I've heard like a lot of stories about like suicide and stuff.
Yeah.
Like some people aren't so open about it, so you don't really know if that person has depression, but I can kind of tell.
I know somebody who did have depression.
Yes.
Yeah, my dad.